Imagine a tool that could drastically reduce inflammation, speed up healing, and aid in weight loss. That's the power of peptides. And today we're going to be deep diving into this billion-dollar industry with a medical professional who's speaking out about this industry for the very first time in Kenya. Peptides are probably one of the most talked about things in the world right now. If you're on TikTok, any kind of social media, you've been talking to friends, you have probably heard about one or another peptide. Today, we'll be talking about a range of peptides, from BPC-157 for recovery, for copper peptides such as GHK-CU for skin and hair, for growth-enabling peptides like tesamorelin, and even one of the most widely discussed peptides in the world right now. Can you guess? You're right, Retatrutide. I don't know how to say this, but this is literally not an episode to be missed. Gather around with your friends and your family and listen. And by the end, you're going to get some shocking realizations. You're going to learn so much about peptides. And if you have any questions, we're here to answer them. I'm Faz. And as always, we're talking about all things unfiltered. Dr. Khoda, it is such an immense pleasure to welcome you on Life Unfiltered. Thank you so much for taking the time to be here.
No, thanks. It's a pleasure, especially this topic we're going to talk about.
Absolutely.
Very exciting.
It is actually going to be my most favorite. I can already tell because I'm so incredibly passionate about peptides. And I think this is the first time that we are actually going in public and talking about it in Kenya. I don't know if you've heard about it before or if people are actually talking about it, but from what the research I've done, I haven't seen anything.
Well, neither have I, especially in our local scene.
Mm-hmm.
And I think it's good. It's going to be great. It's taking off.
It absolutely is. So maybe just to tell us a little bit of a background about yourself, and we can lead into how you got into peptides.
Right. So, I mean, I'm a physician, medical practitioner,
Mm-hmm.
and I've been practicing with 17 years now. And I found out about peptides in 2024. Unfortunately, personally, had a heart condition,
Okay.
which was pretty serious. And this is how I was told about some peptides by specialists, and researched more into it, managed to get some and start,
Okay.
in particular Retatrutide. And it has been a game changer in terms of how it's helped me, both physically and with my cardiac function.
Wow. So that's interesting. So you did peptides on yourself before you
Yes.
even knew much about
Yes,
it. You did
yes.
your own research, and
Yes.
you saw benefits to your own self, and that's why you kind of now, I'm guessing, have gone into the path of peptides.
Exactly. I mean, I really didn't know much about them,
Mhm.
even as a medic. We knew the commercially available ones that we do use day to day almost.
Mhm.
And when I looked more into therapeutic peptides for optimizing just general health, well-being, and changing your body composition, they're pretty much simple amino acids, which are mimicking natural biologic molecules in the body. Which was one great thing. They have very good bioavailability, and the best thing is that they work. They actually work.
So let's go in a little bit deeper, because I think most of the people out there, I personally posted a video on TikTok recently that got over 150,000 views, which just shows that there's a lot of interest in peptides, especially in Kenya and maybe around Africa. So people like myself and those watching who are getting all their information on TikTok and social media, tell us a little bit more. I think you've touched on this, but what are the what are the actual pinpointed benefits of peptides?
So, I mean, it depends on your goals, what you're going through as well. Generally, I'd say immediately is a feel-good feeling.
Okay.
So you feel them work straight away, which is encouraging because you feel amazing. Body composition starts changing, and for me, being a doctor, I medically monitor and get metabolic tests done, and people who have certain conditions, we use those tests to monitor their progress, and we are seeing huge results from these.
So you've said body composition, so that's kind of like weight management, let's say.
Weight management is the biggest thing right now,
Okay.
obviously, with everything going around Ozempic, Mounjaro. Weight loss is a big thing, but improved muscle tone, regeneration of injured, painful joints.
That's a big one.
Hormone control in menopausal ladies.
Right.
It's working wonders.
I mean, we're going to go really deep into the menopausal because I'm a perimenopause. I'm going through perimenopause. I've been going through it for about 2 years. And peptides have tremendously helped all of my symptoms. But let's go back to the one that you were saying, because you just mentioned Ozempic and Mounjaro. And those two I know have a little bit of a negative or a bad name in the industry right now. Can you tell us why?
Well, I mean, look, these peptides were made for diabetics.
Yeah, right.
It helps them a lot because instead of taking 20 pills a day or injecting insulin 3 times a day, they have to inject once a week. And it helps with their overall, quality of life. When it's circulated into the general population, there's no medical monitoring, it's not prescribed. You have to be careful because high doses of these do eat up your muscle.
Right.
You lose weight, but you look aged.
Right. So I think that's the direction from everything that I've been reading with things like, so they're also GLP-1. Am I correct?
Yes.
Okay.
Yes.
So with some GLP-1s like Mounjaro and Ozempic, it pushes you a little bit further into that weight loss category, but they were meant for, like you said, for diabetics.
Exactly.
So if you're just like let's say me,
Normal.
and I'm looking for to lose, 3 pounds or 3 kilos or whatever it might be, and then I start to go on Ozempic, that doesn't seem to be the way that it was initially created for that purpose.
Exactly. It's dangerous. I mean, you need to be guided on what dose to start on.
Right.
There are certain tests which are essential before you start on any peptide. And of course, dealing with the side effects.
Right.
They do have side effects,
Okay.
and you have to be aware of when to stop or what dose to cut off on. Unfortunately, because the results are fast, some people enjoy that roller coaster.
I guess it's
and,
it's like
don't
that taking
stop.
the shortcut, right?
Exactly. I would not call it cheating. I would
Yeah.
not call it really shortcuts.
Sure.
Peptides are revolutionary in terms of how they're helping longevity and optimizing your overall health and well-being.
So you said that you hit the nail on the head, because for me, longevity is the most important thing. As a longevity coach, I really, really have seen what it does to my clients, but I did the experiment on myself as well. So kind of like you, I didn't want to go, and I don't endorse something that I don't truly believe in.
Right,
And the only way I
right.
can believe in it is if I try it myself.
Exactly.
So give me some of the peptides that in your opinion are specifically for longevity and, let's say, help your mitochondria and your ATP production.
So I'd say pretty much all of them help in a way, different pathways. I mean, even Reta itself reduces inflammation.
Sorry, can you tell us what Reta is there?
Sorry, Retatrutide.
Okay, Retatrutide, right.
It's a GLP-1, GLP-2, and GIP. It's a triple agonist.
Okay.
Triple G. It's just come out of clinical trials. It is being used quite a lot and helps in numerous ways, not just weight loss. It has fewer gastric side effects compared to semaglutide and tirzepatide. Newer research has shown anti-cancer effects of it.
Wow.
And it has anti-aging effects, which is amazing because you lose weight and you're going to look younger. So who doesn't want that?
That's like a miracle in a bottle, right?
Yeah.
So, okay, so Retatrutide. So again, we're just going to dive a little bit deeper into Retatrutide, because I do know, so that is a GLP-1, like you said, but it's a
Yes.
triple. So can you just mention that again? It's a GLP-1?
GLP-1, GLP-2,
GLP-2.
and it helps with glucagon as well.
Okay, so is that with for insulin?
Yes.
Like glucagon
Yes.
is your
Yes.
your glucose production, right?
Glucagon, insulin secretion as well.
Yeah.
And it helps burn specifically fatty tissue.
Okay. And again, from what I've noted, the research I've done, it is something that you have to take very slowly. Like you increase the
Yes.
dose very slow.
Yes.
So you start with a low dose and then you gradually work up to
Exactly.
whatever your optimal is.
Exactly.
And that is based
Exactly.
on, let's say, a test that you've done with a doctor. You've done your assessment and they tell you, okay, you need to go up to, let's say, 2 milligrams or 2.5 milligrams. And then you have like a
Yeah.
gradual.
Correct. It's got a good safety profile overall. And the dosage, slow and steady, always works. And this is, I monitor all my clients that way, and guide them on what dose to start on,
Right.
how long we're looking at treatment. And with Reta, there are the studies show that using it not forever, but certain period of time, you're left with permanent changes.
Wow. So for those of people who are out there saying, "Oh, I'm scared that if I get off Retta, I'm going to put all my weight back on," is that a risk that you could have?
Well, look, if you're not careful with your diet as soon as you come off, and if you have certain medical conditions like diabetes, insulin resistance, yes, we are looking at long-term treatment because this is keeping everything in control. Also using it for very short periods of time, losing that little bit of weight, coming off it straight away. Yes, in most people, yes, you may go back, but obviously when you're in for the whole journey, you're being guided, monitored well. Longer term therapy does help a lot.
And I was going to say, so there's also a protocol that goes with it. So it's not that you're just going on Retatrutide, you're taking the injection, once every whatever the protocol is, twice a week or once a week or whatever it might be. But there is also a very strict protocol that you have to follow. What would that be?
Look, I'll use Reta as an example because
Yes.
it's the most popular one right now, and you have to have good water intake,
Yeah,
and
I
you
do.
don't force feed yourself. There is the appetite suppression, and if you do eat when you're not hungry, you will get the gastric side effects. They're not severe, but I mean, you don't want to feel sick when you're on a journey like this. Obviously, certain supplements, because you're going to be losing fat. Vitamin D is fat soluble and gets depleted very fast. This is where you get certain symptoms like hair fall and immunity issues. So I usually check and monitor vitamin D pre-cycle, intra-cycle, and after cycle,
Okay.
which is important. So taking vitamin D is very important. Hydrating well, very important. If any fatigue symptoms occur, then magnesium is really helpful.
Sure.
And you have to have a balanced diet. I mean, just because you're on a jab, the tendency is to, I'll eat whatever I want. If you're sensible with the diet, it works best for you.
Okay, and I have also heard that your protein intake needs to be quite high. I mean, high meaning it has to be quite substantial to make
Yes.
sure that you're not cutting into your muscle growth.
Exactly.
And
exactly.
also, the other thing that I have been informed is that you really have to make sure that you weight train because you do
Correct.
break into, you
Correct.
do start eating into your muscle.
Correct.
So
If
is
you're-
that something that you found?
Yes. Doesn't have to be extreme anything. Rest. You have to have your carbs as well
Yeah.
for these peptides to
Sure.
work. Protein intake, definitely. Movement in general. It doesn't have to be extreme weight training, but just movement, doing some physical activity, keeping your muscle tone up. Addition of small doses of creatine really helps with that.
Okay, that's good to know.
It works very well with Reta.
Yeah.
There is that slight water retention which occurs, but after a couple of weeks goes back
But
down.
I guess also your water
So,
intake, it needs to be higher. So
water intake has
you're
to
kind
be
of
high.
balancing out
Yes,
that
yes,
creatine and
yes.
the water retention.
Exactly.
Amazing. Okay, so tell us a little bit more about what other peptides do you? So again, we're still in that realm of longevity. So we've said Reta that helps with weight loss, and the research I've also done is that the weight loss is actually a byproduct. Like it's like the secondary result.
Yes.
Initially,
Yeah,
it really helps with everything else
Yes.
when it comes to hormone balancing, when it comes to
Exactly.
gut repair, all of that.
Yes, exactly. So another really, really good peptide is CJC-1295,
Okay.
ipamorelin, tesamorelin, and of course the BPC. I mean, like I said, all these peptides overall will help with different pathways of longevity, better skin, anti-aging, better metabolism, deeper sleep, very important. But next on line, I would say CJC-1295 blended with ipamorelin, and sometimes with a drug activating compound, which increases the half-life. So you're not jabbing every day.
Okay.
People new on peptides, we ease into them, starting with the once a week, see how it goes over a few weeks before introducing other peptides, which we stack on.
Sure. So that's
And
interesting because I think when you go online again and you go and you see all these TikTok videos and you see all the people that are endorsing peptides, everyone is just like on one and another, and they're stacking, and there's like three or four or five, or maybe
yes,
even more that they're
yeah,
going with. So it's good to know that your protocol is that you start off with once a week, see how the body reacts, and then stack on from that point on.
exactly. I mean, a lot of clients now, as I guide them, in terms of what they would like after they've lost the weight, reach their targets, we start microdosing on some of the peptides, which just helps overall metabolic control, keeping labs in check, killing the food noise a little bit.
Yeah.
And then comes, the additional stack ones for better muscle definition. If you've lost a bit of muscle, we can recover that with
Okay.
other peptides.
Okay.
So, I mean, there's a peptide for everything,
So can you
you
tell
know.
us for the muscle, I mean, what would you recommend in terms of a peptide if somebody's gone on Reta or Ozempic, they've lost the weight, but they also find themselves that, they've lost a lot of their muscle, which we know we need for, aging.
Just structural integrity.
Exactly.
So 5 amino 1 MQ, it's
Okay.
phenomenal.
Never heard of this.
It's a daily, 5 days on, 2 days off, and this helps with also focal targeted fat loss,
Okay.
immense energy at a mitochondrial level, and increase in muscle mass and definition as well. Stacked with CJC 1295 and ipamorelin or tesamorelin. This is a nuclear stack.
And this is not the Wolverine Stack. Is that something
No,
different?
Wolverine
Okay.
Stack is BPC-157 and
Uh-huh.
TB-500. This helps a lot with inflammatory soft tissue, joint and bone degenerative conditions. It has worked really well in the aging population,
Okay.
very athletic people who have had stubborn joint injuries, which everyone goes through at some point. The more active you are, the higher the chances you're going to damage something.
Right.
And this peptide is also really, really popular now because of its effects. A lot of people have been through physio, multiple, NSAIDs, doctor's visits, surgeries as well.
Yeah.
And when they've started on Wolverine, it's been a game changer for them.
Okay, so I mean, I brought my little stack here, which I will bring out in a second. But one of them that's in here is my BPC, and I have completed one dose and one vial of that, which
Right.
lasted me about a month. And I am a huge believer in BPC-157. So maybe we can deep dive into that a little bit more, because I'm also trying to convince my mom, who's hopefully watching my podcast, that she needs to go on BPC-157. So can you tell us a little bit about first what the peptide is and how it benefits you? So you already mentioned recovery, but does it help with the aging population as well?
Yes, definitely. I mean, BPC-157 is part of the peptide chain for regeneration of cartilage, reduction in inflammation, which is a major pathway here. And in doing so, you get even natural healing occurring.
Okay.
It promotes growth of injured or damaged tissue in the body. And with cartilage especially, it is actually chondrogenic. So it helps regenerate certain areas of cartilage which have been depleted. And, usually this eventually needs surgery. And with doing so, it also does have a bit of an impact on growth hormone secretion.
Okay.
That's why when stacked with, growth hormone booster like CJC and ipamorelin, tesamorelin, they all work antagonistically. It's important to be guided on when to
Yeah.
start which,
Sure.
when to remove certain ones, after a
Right.
while, and do cycles of these.
Yeah.
In addition, when you're on BPC, for example, again, good water intake, staying mobile really helps. And, just taking a good protein supplement, amino acids as well, because these are needed now to regenerate what the peptides are helping with.
Absolutely. So we'll get into the conversation about the growth peptides in a second. But what I would like to say is for the viewers out there is that I had really bad knees. Like I've been lifting weights for over 20 years, and there's been so much wear and tear between my knees, shoulder injuries that I've gone for physio so many times. I even went to a doctor here, a specialist. This was a number of years ago, and he said I'm going to need knee replacement. And of course, there was no way that I was going to do that. I was
Of
like, I'm going to
course.
figure out how to fix this myself. And I did do a lot of physio, but just with one little, let me just pull this out, with one little vial of BPC, which is literally this small. And like I said, I think it took about 3 weeks, 3 or 4 weeks it lasted. And I was taking it every day.
Right.
I couldn't even move my knee before. I'd wake up in the morning and I look like a 90-year-old trying to get out of bed, like staggering to the bathroom. And I have none of that anymore. So when you say that they work that fast, I mean, this is living proof that it actually works that fast.
Exactly. I mean, and that's encouraging because when you see results literally from day one, from week one, and it's just getting better and better and better each week,
Right.
it's encouraging, and you also have to know that some peptides like BPC Wolverine, when you've had chronic pain, chronic conditions over many years, decades even, you will see and feel progress a bit slower,
Sure.
but it's slowly but surely things are going to happen. And I've seen changes when we monitor with scans and imaging as well, lab tests as well.
Right.
We're actually seeing, before some of the physical changes start, we're seeing the internal changes occurring.
Absolutely. And I think that's an important thing to note, is that the peptides are doing so much benefit to your insides. So what you see on the outside is secondary, but what it's actually doing to the inside is primary.
Exactly.
And I think that's what happens, is we expect everything to be visible right away. So doing the tests with a doctor or a professional will actually show you that what's happening inside is actually a benefit.
Yes.
And just because you're not seeing a rapid weight loss, for example, or you're not seeing massive changes to your skin, although I have, and we'll get into that peptide in a second, and I did see the injuries getting better, but what it's doing to my insides and for my longevity and for, better living life, these peptides are truly magical.
Exactly. I tell everyone, until you start on the peptides, you have no idea what they make you feel like.
Right.
A lot of people are reluctant, it's an injectable, and what will happen, what are the side effects?
Yeah.
Being aware of what to expect and, common side effects, being debriefed about that at the start is very important. Um, you know, um, the feeling once you're on the peptides, it is massive. I mean,
So let's address a few of the concerns that people have, because right now it just sounds like we're endorsing peptides and there's nothing bad that can happen to you, and everyone go out and take lots of peptides, which sure, maybe I'm currently doing that, but I don't encourage people to do that. However, so there's two things I want to ask you about. Is one, you mentioned the growth hormones or the growth peptides. What I've also learned is that those peptides can, and I think you mentioned this earlier, can affect if you have preconditioned ailments. So if you have, let's say, a cancer cell, or you have something in your liver or your kidney or whatever it might be, that the growth hormones or the growth peptides can go in and increase that risk. Is that correct?
so regarding this, because I have certain clients who are on these, who have survived cancer, I dug really deep into the rabbit hole on these, and a lot of information. Now, interestingly, not all of them will cause abnormal cells or cancer cells to grow. It's interesting because these peptides are incorporated into normal, healthy human cells. Cancer cells are not normal in one way or another,
Okay.
which is really interesting because certain growth peptides only will cause natural, normal tissue to grow. And in a way, that is good because those cells release chemicals which can, to an extent, inhibit abnormal cells like cancer cells. Obviously, medical background is very, very important before starting on any peptide, like I said. And, monitoring things, for example, in men, if you have a prostate issue, risk of prostate cancer that's quite high.
Yeah.
There are certain peptides you may not want to dilly-dally with,
Okay.
But like I said, digging really deep into the info on these,
Right.
how they work at a biologic molecular level. And of course, I don't want people to watch this and say, Dr. Khoda said it's fine to take if you have cancer.
Right.
You have to be monitored by someone who knows what they're doing, especially when handling peptides.
Absolutely. Okay, that's good to know. And then you also have gray market and black market peptides. So this is one part that really freaks me out. And I think that's what I was trying to cover when I did post this on my personal TikTok was don't just go out there and get peptides from China or a cheap source or, you know, there's risks to that. So maybe you can
Exactly.
just cover
Exactly.
a little bit about
Um,
what the risks are.
with peptides becoming more popular, unfortunately, this is a market that's also growing. And I have seen that. I've experienced it with some clients bringing in peptides. Now, source is very important. And you mentioned China. I mean, it's interesting. A lot of the big labs in the US are actually having their peptides made in China
Right.
for their specific lab. Purity certificates are very important. A lot of people, don't even know that there is a purity certificate that goes with peptides. Each batch you get,
Right.
that's very important. Getting authentic, almost 99 to 100% pure peptides, very important. Peptides, I feel, should be handled by people who have some sort of medical knowledge, for safety reasons. Also, mixing them, that's an art itself. You need to have the correct bacteriostatic water, which is not easily available.
Yeah.
It's a 0.9% alcohol with sterile water.
Okay.
They have to be kept in cold chain. When reconstituting, it has to be very slow introduction. These are fragile amino acid fragments. You bombard it with sudden gush of backstat water.
Right.
You've damaged the peptide. It's not
Interesting.
potent anymore.
Interesting.
A lot of peptides also, after dilution, they do have potency half-life. Some people may not know that. They might want to dilute and use a certain peptide over 10, 12, 20 weeks, but it might be one of those peptides which loses its potency by half after the first 2 weeks. So you want to do small batches of this.
Yeah.
Sure. Certain ones.
And I
this
guess
is
it's
where
also you don't know how much to mix with, right? So if you have
exactly,
like
yes,
let's
yes,
take an
yes,
example
yes.
here.
Correct dosage, as per individual, not just what somebody's using on
Right.
what you watched on YouTube or TikTok.
So I have
It's
a
very
cold blend
individual.
here, which we will talk about in a second, and it's 80 milligrams. As you can see, mine is empty because I have done one dose of this already. However, it's important to know how much bacteriostatic water to put in here,
Exactly.
and then
Exactly.
how much are you drawing out?
Exactly.
Are you doing it
Exactly.
every day? Do you need to take a break? So all of that protocol is something that a medical professional should be providing.
Yes, I mean, and medical practice, we've not really started into all the other peptides. I mean, therapeutic peptides right now. They are now being shown to be immensely beneficial, and there will be, I think, in the near future, a lot of other peptides which have been circulating on the gray and black market because they're not FDA approved. They're going to get approved because their benefits outweigh any of the risks and side effects.
Yeah.
I mean, I'm talking about certain peptides currently not yet FDA approved, which have fewer side effects than approved medications.
So can you give us some examples of which ones?
So, for example, ipamorelin, CJC 1295, BPC, and TB-500, in terms of the effects they're having and replacing, multiple NSAID use, even to the extent of PRP and stem cell injections. Those are painful. Sometimes it can be a hit or miss. It takes a bit of
I believe
time.
there's some of them that
for
help
that.
PCOS as well, right?
Yes, a lot.
Okay.
Like, for example, Retatrutide immensely helps with PCOS, insulin, sugar regulation. I've had some cases where the cysts have totally disappeared after 6
Wow.
weeks. And, obviously, PCOS has a lot of other changes. Endometriosis, adenomyosis as well. We are seeing the triple agonists really helping with that, in terms of your daily quality of life as well.
Right. I mean, it just sounds it sounds almost surreal. And from everything that I've learned, it is as surreal as it
Yes,
sounds.
yeah, exactly.
So let's dig a little bit deeper in terms of the FDA approval. So I know there's a lot of people out there who really base a lot of things on FDA approved. So, I mean, I read somewhere that even vitamin D is not FDA approved. So I think when we base so much of our understanding of peptides and medication and, the world of medical science on FDA approval, is there a little bit of a hit and miss there?
Well, you see, being in the medical field, we have to look at safety, avoid litigation, A lot of common drugs we use are not all FDA approved, but they're
Sure.
in daily use. I feel there may also be a lot of bureaucracy with getting the FDA approval. Some of these peptides are going to kill big pharma.
Right.
Huge oral brands of diabetes, blood pressure,
Right.
cholesterol
Exactly.
medications. These are all going to stop with
Yeah.
certain peptides, and we are seeing that right now.
Right.
Peptides are going to take over.
So when people are saying this thing, it's not FDA approved, but when it is FDA approved, the price is going to skyrocket.
Of course.
And secondly, the reason that they're not FDA approving is because then the pharmaceuticals don't make money out of this.
Exactly.
So
Exactly.
there's a benefit to actually doing the research and understanding why the FDA hasn't approved it without just, looking at it as a blanket statement.
Exactly. Like I mentioned at the start, peptides are biologic identical molecules.
Yeah, so that's what it is, right? There's over 3,000, if I'm not mistaken, peptides that are already made in your body.
Exactly. Yeah. These
And
are
so,
essential daily parts of
right,
our body.
right,
As you age, they get depleted. We're looking at
correct.
all the other factors, diet, GMO foods,
Mm.
environmental stresses, what we call endocrine disrupting chemicals. These deplete your peptides, and this is where these peptides available,
And that's why I guess
help.
perimenopause and menopause women,
Exactly.
there's so, I mean, it's not
Exactly.
only our hormones that are depleting in
Yeah,
our
it's your
body, it's
quality of
also
life,
yeah.
day to day.
I mean, my energy level after taking
Yeah.
peptides is through
Yeah,
the
yeah,
roof. I
exactly.
mean, I couldn't get
Exactly.
through the day without feeling, whether it was brain fog, whether it was
Right.
lack of energy, whether it was lack of production or focus. I mean, I really found it very hard to focus on anything, let alone just work, but even basic conversation. And I feel like everything has changed.
Like I said, you don't know how amazing it is till you're on them.
I mean, I'm on them.
And pretty much every client on peptides has felt exactly the same.
Right. Okay. So let's talk, before we talk about my favorite one, this one is NAD plus. Now, I've been taking NAD plus for over, I don't know, I want to say 5 or 6 years. However, not in this form, not in a peptide form. I was taking it as
Infusions.
an IV
Right.
and booster shots. So every time I'd
Right.
go to the UK or I stayed in the
Right.
UK for a bit, they had booster shots, which, by the way, they always ran out of. So I always knew this was the right thing that I was doing. And recently, I just finished my first, again, full vial of NAD plus. Can you tell us a little bit about this?
How did you feel with the sub-Q?
I mean, to be honest, okay, so let me tell the truth, because this is Life Unfiltered. We don't keep anything to ourselves here. Injecting it was horrible. It was absolutely excruciating. But I just felt very much like I was in a spaceship. It only lasted for, let's say, 10 minutes max. But I would wake up early in the morning, take the shot, and then literally have to lie down and recover from the shot for 10 minutes. Now, I don't know if I was doing something wrong or if this is just how NAD reacted to my body. But once I got over the 10 minutes, I felt like I was invincible.
That's why I asked you how you felt. So with NAD, personally, me as a physician, I'm not the biggest fan of NAD.
Okay.
It has its huge benefits. The energy, like you said,
Mm-hmm.
mental focus, it helps with your brain chemicals.
Yes.
Improves mental focus. It has side effects. Even with the infusions, they have to be correctly dosed, very slowly given. It can cause a massive excitatory effect. And, in medical practice, a lot of my clients may have high blood pressure or some sort of cardiac issues. We have to be careful with molecules, especially like NAD.
Yeah.
As much as the benefits are there, yes, super energy and, definition, good for the skin, brain, just your central control system improves with this. Neurologic system improves with that. But yeah, sometimes if you inject a dose and you hit a small blood vessel with one like this, you have to be careful. It can cause massive vasodilation, which can be quite dangerous.
Okay. Good to know. So the next one, I'm coming to you to get done.
No
No,
worries.
I mean, I don't think, and that's things that I don't know how many people actually talk about NAD, because we always talk about the benefits of NAD, but nobody really deep dives into, okay, I'm taking this shot every day or every week or whatever it might be.
Yes, what to look out
What are you
for.
looking out for?
Exactly.
You know, and I see so many people posting about it, like, oh, it's so easy, just draw out, 50 milligrams or 50 units and inject it into your glute. But I literally felt like I'd been hit by a bus. And if you have
Joint
kids or you
aches.
have, if you're taking it right before you're driving, for
Yeah,
example,
can be dangerous.
it can be really dangerous.
And like a lot of these peptides have a very, very rapid bioavailability. So literally seconds after injecting it, you can get potential side effects.
Sure.
Some may be transient. I mean, look, with CJC, ipamorelin, you feel a bit flushed. There's a little bit of injection site irritation with those, but you feel flushed, a bit of a rapid heart rate. It's transient, but being told and being monitored by somebody who really knows what they're doing with peptides is important, because
Absolutely.
if you're not medically aware of what can happen and you just sell it off to a client, you're just someone selling peptides.
Yeah.
A client's not aware of what to happen, they do the wrong thing, it could kill them.
Right. Wow. That's a statement. Okay. Should we get to my favorite peptide? Can you guess what it is? I'll give you a hint. It's blue.
GHK-CU, yeah,
This
very, very
okay, so
famous
this
one.
is the one of the most famous ones I think right now is the copper peptide. First, you need to tell us what is a copper peptide.
So basically it's copper binding, and it helps again with inflammatory pathways. This is the one the ladies love because of obviously anti-aging, very, very strong anti-aging properties, especially at the skin level. It helps to an extent with bone, soft tissue, joints as well.
Okay.
And results are very fast, very good results as well. This is a peptide which it's another daily. We look at 5 days on, 2 days off, and cycling this peptide, very important. In terms of its anti-aging and anti-inflammatory effects, it is really good, and it will help with your energy. I don't know if you noticed that. Pretty much most of
I
these
mean, I
help
think I'm
boost your
taking so
energy.
many. So I
You
think
don't know
that's
which one, yeah. I mean, look,
I think that's the problem with stacking, right?
yes,
Is that if you do one and then stack, then you can kind of tell what the benefit is.
yes,
Now, I am joking about the fact that I take them all together. I was very particular with taking one and seeing the benefit.
right.
With the GHK-CU, which is one of the first ones that I did try, I didn't quite notice the difference in energy. I think that one for me was more the BPC. However, this one, and I'm not just exaggerating, within the first 3 days of taking GHK-CU, I saw a major difference to my skin. I've already now seen a difference. So, like I mentioned, I started to take GHK-CU and then I switched to the Clo blend, which also has GHK-CU. And maybe we'll talk a little bit more about that blend and the blends and why
Yeah,
people take
yeah,
it
right.
instead of just the straight GHK-CU. But I did find that my hair, thanks to perimenopause, for the last, let's say, 3 years, had not grown. I had very limp hair. I'm not saying that I have the thickest, most luscious hair right now, but every time I go to the hairdresser or I go home, my mom, the first thing she says is that your hair has really changed. So I've noticed a massive change to the texture. I've seen new hair growth. And more so, I feel like my skin has completely changed. I mean, there's so much more. When I say collagen production, I mean, there's more elasticity to my skin. The texture has changed. I mean, they're saying that this can take over Botox in the next few years.
Well, I mean,
Is
yeah,
that
with
just a
the
claim
growth
or?
hormone, promoting your growth hormone, it helps with additional benefits as well. Not, I mean, just the skin. I mean, as a lady, good hair, good skin,
Yes, of course. That's
energy,
what we're looking
glow,
for.
hot flushes. What
Yeah,
more do you want?
yeah.
Um, this is one of the very popular ones.
We say that GHK-CU is good for women, but I'm sure there's benefits for men too.
Yes, 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 a lot. I mean, we look at again balding, good hair, post injury. This has its place as well, and this is where I'd say the blends come in.
Right.
Rather than doing isolated peptides, having to measure and mix, Pre-mixed, pre-dosed blends are convenient. So you're not doing 3 or 4 different jabs at a go. It's a
Okay.
single jab which has everything in one.
Right.
But for example, Clo and Glow, these are peptides which can be mixed together. There are some which should not be mixed in the
Right.
same syringe at all. And in terms of convenience, the blends help a lot.
So in Clo, we have the BPC, which is one of my favorite ones. We have TB-500, GHK-CU, which we've just talked about, and KPV.
KPV.
Can we go a little bit deeper into the TB-500 and KPV?
So TB-500 works antagonistically with BPC in terms of its anti-inflammatory regenerative properties. KPV is newer actually, and I've seen amazing benefits with KPV even on its own in severe allergies, psoriasis, which is of course a skin condition.
Right.
And obviously people who are constantly inflamed, when you bring that down, your energy naturally goes up.
So KPV is more for is very much targeted towards inflammation.
Inflammation, and it's helped a lot with allergies. People
Okay.
with very severe
Interesting.
allergies, KPV has been amazing. Now with KPV again, it's one of those intense peptides which you may even have to inject twice a day for the first 5 to 10 days, depending on how severe or how fast you want to see an impact.
Okay.
And then taper it off. So I mean, there are guidelines you have to follow and know what you're doing.
Of course, absolutely.
Each individual varies. So what may be written as a certain dosage is for the average person. If you're heavier or lighter, you need someone to guide you on what and how much to start on.
Okay, correct me if I'm wrong. So you actually provide peptides right now, is that right?
Yes, so I mean, I have selected peptides which
Okay.
I've been using to help a lot of clients who are not benefiting. When you're doing everything right, you're on multiple medications, and this I found out from my personal experience. How peptides have helped me change, how they've helped my heart recover from what was potentially a deadly serious condition, despite taking medications. And I like it when people come back happy, and
Sure.
livelier. We're not only improving your quality of life, but your longevity as well.
Absolutely.
So we're in our prime years. Make the most of it.
Yeah,
Feel
and
good, look
I
good.
mean, like I said, I'm trying to get my mom to start some peptides as well. I really believe that once you get to a certain age, there's certain things that you're doing that, her diet is not as protein rich, let's say, as I would like. She's very active, but she still has joint problems. She has injuries. She goes through a lot of fatigue. So I know after doing it on myself, I would never do something to my mom that I've not tried on myself. So I really am a believer in peptides. And I'm really happy that we're having this conversation because, like I said, I think the two things for me is one, to make sure that you have a medical professional who's telling you what you can and cannot do, doing the right tests, but also the sourcing. And this is the one thing, like maybe we can touch on that a little bit more. I know we already have, but I do trust that you have a very reliable source because you are, as you said, using it on yourself as well. And what is, the importance of people to make sure, and I just really want to hit the nail on the head on this one, is make sure that they're sourcing it from a reliable place.
Correct. Also, sourcing, storage, mixing correctly,
Right.
injecting correctly, sterile, syringes. And on that topic of peptides being used medically, there are certain people in the population who may need a major surgery. They're not in the right shape for that surgery, and peptides help either prevent the surgery or make the recovery much
Okay,
better
that's interesting.
after the surgery.
So I guess, someone like my dad who just got out of hospital and has had multiple surgeries in the past, if some ailment comes up where peptide can help, he might not have to ever go for surgery again.
Exactly. I don't want to mention costs, but just to say that, cheaper product usually means lower quality. That's what everyone has to understand. Everyone wants to do the peptides. And this is where the gray market, black market flourishes. When someone's offering something cheaper, you'll feel some benefits, but you don't know what you're injecting. How pure is that certain peptide? It might be mixers in there. And this is where side effects come in. A lot of insurances, unfortunately, don't cover the peptides, especially obviously the non-FDA approved ones.
Yeah.
But if they come on board, that'll be great because, financial burden currently with the whole economy worldwide. Also, a lot of companies say bringing the peptides in powder form, you don't have to really worry about cold chain. But I still say, try as much as you can, bring them in cool chain or cold chain.
Okay.
Because, massive temperature fluctuations at anywhere along the line, if it's not being monitored, will damage your peptides.
And I think the last thing I'm going to say is that in terms of cost, of course, every peptide costs different. So if you're going for the cold blend, you're going for NAD, you're going to BPC, and then it also depends on your protocol or how long you're using it for. I think for me, what I've noticed is that the peptides actually overall cost less than if you were going to go and if you got sick and you're going to go for recovery.
Exactly.
Or if you're going to the physiotherapist
Exactly.
and you're like, I got this injury that's been there for 2 years and you've been going to physiotherapy sessions for 2 years. Generally, I don't want to make it a blanket statement, but I assume that generally going the route of peptides is cheaper so the prevention is cheaper rather than treatment.
You're correct. I mean, look, over time, there are a lot of benefits and cost-effective benefits to peptides. Now, you mentioned physiotherapy as well. A lot of physiotherapists are more inclined to using certain peptides. I mean, when you have a client who has constant recurrent pain despite doing multiple sessions of physio, introducing a peptide like BPC or the Wolverine Stack, improvement of quality of life, less pain, regeneration of that affected joint, and obviously saves you from surgery plus its risks.
So looking ahead, how do you see peptide therapy evolving in the next few years?
Well, look, if correctly done, monitored by professionals, obviously quality control, peptides are the next big thing. There'll be a peptide for literally everything.
Sure.
And being bio-identical molecules, fewer side effects, and less consumer cost burdens as well.
Right.
And these are things which you can then administer at home. A lot of people are scared of injections, frankly. Peptides are injected with usually insulin syringes. Some of the FDA commercially available ones come in, convenient pens to use.
Yeah, I've seen that.
When the technique is done right, taught how to do properly, it's painless.
Okay. And you do teach people, I'm assuming.
Yes,
so you don't always have to come into your clinic.
Yes.
I mean, I administer myself. I need to learn to make sure that I'm doing it properly.
Yeah.
I also want to just touch on the fact that different insulin needle gauges, so that's the length of them, could be used for different peptides.
So I tend to prefer sticking to a very short, very fine needle.
Okay.
Just to reduce risk of going beyond the subcutaneous layer and hitting a blood vessel, for example. So we look at anywhere between 4 to 6 millimeter length needles, ultra fine, and obviously sterile insulin syringes.
And it's very important to make sure that you sterilize the product that you're using, to make sure that you're using antibacterial, to make sure that you're cleaning the space well. I think the only question I have is the difference between subcutaneous and intramuscular.
So intramuscular is deeper, and there are very specific sites and a lot of caution you need to observe for that. Ideally, intramuscular, if you're self-injecting, it's the upper outer thigh. Again, these are a bit more painful. Intramuscular products are usually oil-based, so they're depots. Like I said, painful, and you're going in deeper. You're not sure if it's a blood vessel. You always have to pull back. With subcutaneous, it's usually easier, faster, and much faster bioavailability with sub-Q.
Okay, and sub-Q is just going through the skin, right? You're not going deeper than that.
Yes.
It's something like glutathione, which is something that I just recently started. Is that sub-Q or is that intramuscular?
So glutathione, most formulations ideally, given as an infusion would be better.
Okay.
That depends which product you get, because some are depot, longer release. Those are intramuscular usually. Faster ones, which can be given subcutaneous, you just have to watch out, because glutathione, again, like NAD, can give you a bit of a skin irritation.
Yeah, I haven't actually felt anything with glutathione. I do feel, like I said, the NAD just knocks me out for 10 minutes. And the copper peptide really does burn.
Yes, over time, I mean, alternating injection sites, very, very important.
Sure.
Knowing when to take time off cycle,
Right.
for example. And, like you mentioned to me earlier, icing the area before just
The
makes it
icing has
easier.
made it. The
Yeah,
icing is
yeah,
actually a game changer.
numbs the
And
skin
actually, even leaving the peptide out, so leaving the Clo blend or GHK-CU
just to
out,
warm up a bit.
to
All
get
right.
to
I mean,
room temperature and then injecting it.
not always a must. Some people don't have time to do that. It's just out the fridge, inject. When it's cold, yes, it sort of numbs it up actually. When we're injecting sub-Q, self-injecting, always pinch the skin.
Yeah.
Make sure the surface is tight.
Okay.
It's much less painful.
Okay. Good. Wow. Well, I've learned a lot. Thank you so much. I'm just trying to wreck my brain to think if there's anything, and if there's anyone out there, you have more questions for the doctor, please post them. Please put them. We'll put all your links so that you can contact the doctor directly. And if you have any questions, like I said, I'm happy to come back and have more conversations. We can even,
Yeah, no, sure, yeah.
maybe you could, when I'm at the office and we're injecting, you can just teach people how to inject. I'm happy to do a video on that.
Absolutely.
Just so that they can see what the insulin needle it looks like. I know there's a lot of people that there's so much fear around this of injecting. I've also found that, injecting does not have to be painful if you do it correctly. I think my last question, so that we end this off in a happy, good note. Give me your top 3 peptides that you think work the best. And tell me why. Okay. And I know there's so many, but I'm going to put the pressure on you to say, what are your top 3?
No, I've got it. In fact, they're the 3 that I'm now stacking on right now.
Okay.
Reta as the base.
So Retatrutide.
Retatrutide as the base. Base peptide, which I've been on for a couple of years now. Loving it.
Okay.
CJC 1295 with ipamorelin and drug activating compound.
And so tell us what that does.
So that's for energy, strength, muscle mass, good deep sleep, and just the energy is immense when you're on it.
So when you say muscle mass, sorry, actually I do remember. Yeah, and I do remember something that I wanted to ask you actually. So what is the difference? Okay, let's get to your third one first. Sorry, I'm cutting you off.
So third one is the newest one I've started. That's 5-amino 1-MQ. Again, very, very good energy levels, mental focus, clarity, and you feel like you're buzzed. You know, that feel good feeling. Mood's always up there, and it's helped. It's helped with certain stubborn fat loss as well. Okay, especially when you're on the GLPs, when you're on a very low intake. 5-amino 1-MQ really helps keep the metabolic rate running on a small intake. Okay.
So this is the interesting question. So if why is this under the same category as steroids?
No, good question. A lot of people fear that. No,
yeah.
Steroids is a vast. Again, that's a big area as well. We're talking anabolic steroids, obviously. These are for hormone replacement. Majority of them are synthetic. They're not part of the natural human peptide chains. Okay. They're bigger molecules. They obviously they do have a lot more side effects. They have to be strictly monitored. They do affect things like your cholesterol. When you're on steroids, cholesterol goes up. Your kidney and liver functions have to be monitored quite closely. And sometimes with anabolic steroids, you have to be careful on how long you cycle them for.
And from my knowledge, because I have been in the fitness industry for the last 20 plus years, anabolic steroids actually give you that big, almost inhumane looking muscle mass. I mean, but GLP-1s and also peptides don't really, you can get more leaner, you can look more, natural, because these are chemicals, not chemicals, they're molecules that are already produced in your body naturally.
Exactly. I mean, with therapeutic peptides, it's about lean, clean muscle. Okay. Obviously, professional bodybuilders have their targets, their goals.
Exactly.
To have as much muscle, even if genetically your skeletal structure cannot handle it. And, unfortunately, we are seeing a lot of pro bodybuilders coming off out of the scene, really suffering a lot.
Absolutely. I mean, there's so many health there's so many health risks to going on steroids. So I just want people out there to know that peptides and steroids are a whole different category.
Yes, totally.
They're completely different. The way that they react in the body is different. The molecule is different. Pretty much every single thing that you can think about is
exactly. Exactly.
Okay.
Now, you see, again, with anabolic steroids, they also cause abnormal tissue to grow. So that's a big risk if you're hiding a cancer.
Right.
Bigger risk of cancer with steroids.
Steroids than peptides. Amazing. So we have your top three. Mine is definitely, well, I haven't done as many as you have. I mean, I haven't done some of the ones that you have. I think I'm definitely going to dabble a little bit more. Mine would be GHK-CU, definitely. BPC, 100%. And right now, I know we talked a little bit about glutathione, but I really do see the benefit of that one.
Nice.
Yeah.
No, good. Keep it
Yeah.
up. You're looking great.
Thank you.
Yeah.
Thanks for my peptides. Before I end, I'll ask you one thing. So Retatrutide, you said, is for weight loss it's not for weight loss mainly. It's all the benefits for longevity, and then the secondary or the byproduct is weight loss. What if someone like myself, for example, I don't need to lose weight. I don't want to lose weight. Is there still a benefit for me to take Retatrutide?
100%.
Okay.
I mean, Retatrutide is one of my most popular peptides. Obviously, because of all these other benefits, reversal of fatty liver, hepatic steatosis, which controls then your cholesterol, sugar. With weight loss comes better blood pressure control. Now, someone like you, for example, we'd look at microdosing. It does kill the food noise a bit.
Okay.
So, you're a bit more controlled in your intake. That little drop in subcutaneous fat can happen.
Okay.
But it's also more for the hormone control that it has, the anti-inflammatory effects of Retatrutide. They're very prominent. Yes, you don't have to be big to be on Retatrutide.
Right. I think that's also a misconception that people have. And so it does also help, like we already said this, but it helps with perimenopause and menopause, but even for somebody who's not looking to lose weight, for example. Okay.
For me, as an example, it helped reverse heart failure,
right,
which is amazing.
Okay, well, that's great. So if there was 3 peptides that you would suggest from what you know of me, and I know I haven't done all the tests yet, and we will do that for sure, but what are the 3 that you would put me on? So we just mentioned Retatrutide.
Same stack as I am on, by the way. Low dose Reta. CJC ipamorelin.
And that one was the one that was specifically for if you're going to the gym,
yes,
you want the energy, the lean muscle. Okay.
Strength out of this world.
Okay.
Better recovery after exercise, less sore muscles.
Okay.
And 5 amino 1 MQ keeps you lean. If you're on a small intake, keeps your energy levels up. It improves your energy from the mitochondrial level.
Okay.
It does help with cells as well, skin.
That's my whole base right now.
That's a stack I would recommend you give it a try.
You say it helps my cells and my mitochondria.
Come see me on Monday. We'll sort you out.
Okay, so all of you guys who are watching, I am going to go to the doctor. You've just heard he's invited me there on Monday, and I will record my session with you and post the stack that I'm taking so that everyone knows that this is all real. This is all unfiltered. We're going to go on the same stack and see what happens.
Super.
And I will monitor on a weekly basis how I'm feeling energetically and all the rest, and go from there. Thank you so much, Doctor, for being here. Dr. Khoda, the information you've provided is priceless, and I really do hope that people reach out. This was one of the most incredible episodes. Dr. Khoda shared so much information about peptides. I hope you all learned as much as I did. There is so much more to learn. Please don't forget, share this episode, and don't forget to subscribe for more information about peptides. And write your comment in the comments below. We're here to answer any questions.